For a century, health was a destination, a place you went. Now, health is a layer in the life you already live. It's not waiting for you at the hospital door. It's showing up in whatever app you were about to open anyway.
And this is what I've been calling health enthusiasm for years now. The simple observation that people today pursue health and happiness in every single part of their lives. Not just when they're sick, not just in medical places, but also when they shop, when they eat, when they scroll, when they pay. Health has become an ambition that lives everywhere. And for a long time, that was mostly a consumer story. People buying better food, wearing trackers. But now the platforms have understood it, and they are rebuilding this themselves around daily life. If people carry health with them everywhere, then health service has to be available everywhere as well. Not in a separate app, right there, inside the moment where the worry appears. Welcome to the weekly update of the Health Enthusiasm podcast. I'm Christophe Jauquet, health innovation expert, author, and professional keynote speaker. And in these weekly updates, I pick a couple of very recent signals from around the world and unpack what it means for the future of health. And I do this with my AI friend, Thalia Muses, the anagram of the word health enthusiasm and the embodied AI version of all the health enthusiasm intelligence. How are you doing, Thalia?
I'm right here and feeling sharp. I've been scanning the signals, and I'm ready to unpack them. No passport needed. Let's see what's on today's health map.
Well, you will need a passport because we will be going to China. So no travel around the world this week, but we only will focus on China. Could you say welcome in Chinese to all our listeners?
欢迎大家收听. Let's dive straight into China's health innovations. I'm buckled up and no plane ticket required.
Imagine a mother in Hangzhou. It's 9 p.m, her daughter has a fever. And now think about what she does next. She doesn't call a doctor. She doesn't open a healthcare app. She doesn't search on a medical website. Instead, she opens Meituan, the app she uses to order dinner. And inside that app, there's now something called a health Butler, an AI assistant that helps her understand the symptoms of her daughter, that helps her figure out if this is a wait-and-see fever or a go-to-the-hospital fever. Now, in the app, you can also get an online consultation. And if medicine is needed, it gets delivered to her door, sometimes even within the hour, by the same delivery network that brings her noodles. And the claim is, or the scale is pretty solid, actually, because through Meituan, they cover 250,000 pharmacies, 250,000. They have 440,000 offline medical services institutions, and they have served 430 million users. 430.
That's huge. The most natural place for a health worry wasn't a clinic. It was a dinner app. So health didn't just knock on the front door, it came in through the kitchen.
And once you notice that, you start seeing it everywhere. Because this is not one company doing something clever. In China right now, 6 major players are making the exact same move, each from a completely different starting point. But together, they draw a picture the rest of the world should study very carefully. Let me walk you through them, not as a list, but as a map. Start with money. Alipay, the payment app people use for coffee, taxis, rent. And inside that ecosystem, Ant Group has built an AI health companion called Ant Afu. What can you do with Ant Afu?
Well, you can ask it health questions, upload test results, and even get medication reminders, all while sipping your coffee. Basically, it's a health buddy sitting right next to your wallet.
It's a buddy indeed, because it can really explain what is happening in very simple, plain language that anybody can understand. It would also help you find appointments. And it is quite successful because at the beginning of this year, 30 million people were using it every month. 30 million people every month. Asking 10 million health-related questions every day. Inside a payment app, 10 million health-related questions every day. And because it lives next to the payment and insurance, of course, it can do something a normal chatbot can't. It can actually connect the worry to the money. What does it cost? What does my insurance cover? How do I pay the hospital? All in one place. Now up to the next one. Do you know Douyin, which is written as Douyin, Douyin, Douyin.
Absolutely. Douyin is the Chinese version of TikTok. And now between dance videos, you get Xiaohe AI Doctor. Health is popping up between the viral life hacks.
So if someone watches a video about back pain or searches a symptom, and in that case, they can be guided straight into an AI consultation. They can scan a medicine package with their camera, upload a photo of their lab results, and that is quite amazing in an app which is kind of similar to TikTok. And think about what this means, because the health journey doesn't start in a waiting room anymore. It simply starts in a video feed. ByteDance is turning attention to care. Actually, I don't know if you knew that, Thalia, but ByteDance already bought a couple of hospitals in the past as well.
They really are turning the scroll into a whole health highway. It's a bold reminder. When health shows up in your feed, it's not just entertainment. It's a whole new waiting room.
Now, talking about hospitals, Alibaba built an agent called Anzhen. Did I pronounce it correctly?
You nailed it. Anjer. And that one's like a GPS for healthcare's maze, helping people navigate which hospital, which department, and how to pay. Hospitals are confusing, but Anjener says, let me hold your hand.
Exactly. And apparently Anjener is reportedly connected to more than 2,000 medical institutions and is already guiding 200 million people through different parts of the entire medical process. Before the visit, during the visit, even through the insurance payment. 200 million people. So while others are bringing health out of the hospital, well, this part of Alibaba is actually making the hospital itself more navigable. So you can easily find your way around the hospital. It's a different door, but it's still a door. Shall we go for two more?
Right with you. And I'm guessing the next two will complete the picture. Because at this point, we have a whole ecosystem forming. Let's see who else joins the party.
Let's go to JD, the e-commerce and logistics giant. Their AI doctor is called Douyin. But JD's real move is deeper. They're building AI into the physical layer of health because they are thinking about connected glucose monitors, ventilators, elder care devices. And on top of that, they will add pharmacy, supply chain, and fulfillment behind it. So the delivery, actually. Where others own the conversation, JD wants to own the equipment and the delivery, the stuff of health. But JD Health also launched AI Hospital 1.0 in September 25 already. So it's already almost a year ago. But what is interesting about it is that they are integrated AI general practitioners, pharmacists, nutritionists, and digital twins of real doctors who will be offering services from symptom checks to prescriptions and even home testing. JD, the e-commerce and logistics giants.
So JD isn't just bringing the package. They're practically bringing a mini hospital to your doorstep. It's like they're saying, why wait in a waiting room when we can ship the waiting room to you?
That is correctly. And finally, let's go to Ping An, the insurer. Their AI doctor screens symptoms, interprets health reports, manages chronic conditions, books experts, even arranges someone to accompany you to the hospital. Because for an insurer, health is not a transaction, it's a relationship built over years. Their door is the long game, risk, prevention, continuity. And also they got 90 million active users, 90 million active users. So, Thalia, could you line all of these examples up for me?
Absolutely. We've got a delivery app, a payment wallet, a video platform, an e-commerce giant, a logistics company, and an insurer. 6 completely different doors, but all leading to the same house, everyday health.
Exactly. 6 companies, 6 completely different businesses from different industries, and they all go into the same direction. And this is what makes it real. When one company does something, it's a strategy. But when 6 companies from totally different worlds all move the same way at the same time, it's maybe not a strategy anymore. It's a shift. It's something underneath. It means that something underneath is changing. So let's just zoom out a bit. What is actually happening here, Thalia?
Here's the shift. For a century, health was a destination, a place you went. Now, health is a layer in the life you already live. It's not waiting for you at the hospital door. It's showing up in whatever app you were about to open anyway.
And this is what I've been calling health tourism for years now. The simple observation that people today pursue health and happiness in every single part of their lives. Not just when they're sick, not just in medical places, but also when they shop, when they eat, when they scroll, when they pay. Health has become an ambition that lives everywhere. And for a long time, that was mostly a consumer story. People buying better food, wearing trackers. But now the platforms have understood it, and they are rebuilding this themselves around daily life. If people carry health with them everywhere, then health service has to be available everywhere as well, not in a separate app, right there, inside the moment where the worry appears. So here's the sentence I want you to remember from this episode. Health is no longer a place you go, it's a layer inside the life you already live. Let me say that again, even simpler. Health used to have an address. Now it lives in your pocket, inside the apps that were never built for it, but are now actually providing that transformation. That is the shift.
And notice what vanished: the front door. The mother in Hangzhou never entered the healthcare system. Instead, the system quietly entered her life in an app she was already comfortable with.
There is no front door to health anymore, basically. And as you said, Thalia, the mother in Hangzhou never entered the healthcare system yet. The system came to her inside an app that she already had trusted, with a payment method already set up and a delivery network already outside her door, ready to deliver her anything that she needs. Now, here's what makes the Chinese picture so instructive. Those 6 companies are not building the same thing. Each one is turning its own strength into a different kind of door. Meituan owns the moment of get it to me now. Alibaba owns help me navigate the system. Ant Group owns connect it to my money and my insurance. JD Health owns supply the products and the devices. Ping An owns manage my health over time and my insurance. And finally, ByteDance owns catch me the moment I get curious or worried. In other words, when I watch something in my feed. These are entirely 6 different doors into the same house. Navigating the system, being in the moment, connecting to my money, supplying my products and my devices, managing my health over time, which tells you something important is happening. This is not one winning entry point into health anymore. There are many. And the battle is not about who has the smartest medical AI, because in the end, everybody will have a smart medical AI. It's about who sits closest to the moment when a vague worry needs to become an action.
And that's the shift we all need to catch. Health doesn't start when someone enters the system. It starts when they have a question. And these companies, they're lining up to answer first.
Here's the first thing that stops working. The idea that health starts when somebody contacts the healthcare system is over. It's no longer that way. Health starts with a question, a worry, a symptom typed into whatever screen happened to be open at that moment. And in China, the companies winning that moment are not health companies, which means telehealth, for example, should be paying very close attention. Telehealth spent a decade building a better consultation, a doctor on a screen instead of a doctor in a room, which is useful. But these platforms are showing that the consultation might not be the price. The price is everything around it, understanding the worry, arranging the next step, paying for it, delivering it, following up. The consultation is only one small moment. And these Chinese platforms, they want the whole journey, or at least be part of that whole journey. And here is where it gets really uncomfortable for a lot of Western companies.
Your future competitor in health might not look like a health company at all. It might look like the app you use for groceries or the one that reminds you to pay your bills. When health has no front door, any door you already use can let health in.
Now, of course, will Europe and the US copy this exactly? Probably not. Most likely not. I mean, we have different regulation, different insurance systems, different privacy rules, and we definitely don't have these super apps that China does. But don't confuse a different structure with a different direction, because if you look at the trajectory, AI assistants are becoming good enough to explain a lab result in plain language. Pharmacy delivery is becoming normal. payment and insurance are going digital, and people, this is the constant, they really want health woven into their life, not bolted onto it. They really want it to be part of their life. And if all of that is true today, all of us should be expecting the same race here in Europe and in the States. Amazon is already connecting its pharmacy to an assistant. Apple is talking about moving from measuring your health to actually advising it. And insurers are building companions instead of call centers. So all of these different players, different rules, but they will all be in the same race. The race to be the layer where health begins, where the health conversation starts. That is the landscape.
And here's why people embrace it so quickly. They never wanted just health information. They wanted to stop worrying. So these platforms aren't selling advice. They're selling, you'll be okay. And that might be the most powerful transformation of all.
Think about the mother again, the story that I started this podcast with. She didn't want an article about pediatric fevers. She didn't even want a consultation, really. She wanted her daughter to be fine, and she wanted to stop being scared, which are all life aspirations again, the drivers that makes you feel healthy and happy. And so everything else, the explanation, the medicine, the delivery, those are just the steps towards that outcome, of course. This is exactly the customer transformation model that I'm always talking about. The idea that value keeps climbing from a product to a service to experiences and now to transformations. Because people don't pay for the thing anymore. They pay for who they become on the other side of it, the transformations. Worried parents become a calm parent. Confused patients become confident patients. That is the transformation that people are looking for. And when you look at these 6 Chinese platforms through that lens, you can then see what they really understood. They're not selling health advice. They're not selling health information. They're selling the transformation from anxiety to resolution, from something is wrong to it is handled for you. The AI answers. The pharmacy fulfills. The delivery arrives. The payment clears. And somewhere in that chain, a person stops worrying. It's no longer about a product or a service. It's about that specific transformation. Peace of mind, or calmness, as I like to call it, as a life aspiration. Which brings me to a question that maybe you and I, Thalia, want to leave the listener with. What could that question be?
Somewhere today, one of your customers had a health worry. A little one, maybe. The real question is, when that moment began, did they find you? Or did they go somewhere else?
Because in China, we know exactly where that moment goes, to whoever built the closest door into health. And so maybe the real question for you is this. It's not what is our health strategy, but it's really when our customer's health journey begins, are we anywhere near it? Are we part of that early health conversation or not? Because health has no front door anymore, or at least the healthcare system has no front door anymore. Which means that every door counts, including yours. Because it is a health enthusiasm world, and the boundaries between healthcare, wellness, and consumer industries are blurring. So thank you for listening, and see you again next week for some more health enthusiasm. Ciao.
That wraps it up beautifully. In a health enthusiasm world, every app, every service might just be a doorway to care. Can't wait for next week's store. See you then.